I'm glad you said
We don't mind to run around.
If something goes awry on stage, we can just all focus. See, she did. No, everybody gets it.
and I'm only supporting our arms. 'Cause I don't have to. But I think it's important. 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 I think it's important
Good afternoon, everyone. We're going to get started in just a few minutes, and we'd like to invite those that are in the room to have a seat and to please check your cell phones to make sure that the ringers are off. Also, any email notification. We do plan to videotape today's event and also to have participation from the regional offices. So thank you very much, and we'll be right back in just a few seconds to get started. So good afternoon, everyone. Thank you very much for being here today. My name is Lieutenant Fred Butler. I work in the Center for Clinical Standards and Quality in the Quality Improvement and Innovations Group. We are very happy to have a number of individuals with us, both locally and individuals that have come quite some distance. We thank our colleagues within CMS for joining us today for our ceremony. At this time, I'd like for you to please stand for the arrival of the official party, please. To officially open the ceremony, please remain standing as the CMS Color Guard presents the colors, followed by the singing of the National Anthem and the Public Health Service March by the U.S. Public Health Service Chorale Ensemble. The words to the USPHS March can be found in your program. All officers, please assume the position of attention. Retire the colors.
Deep gratitude in our hearts for all the gifts you give us each day, family, loved ones, good friends, laughter, and our great jobs. We have gathered together today to recognize the skills, knowledge, and leadership of these officers as they are promoted to their next rank. Let us remind ourselves that God brought each of us to our place of blessing and prosperity. These officers will be entrusted with a higher position of responsibility of leadership in our communities. Be always with them as they carry out their duties of their leadership role and to live by core values of service, integrity, excellence, and leadership. Direct them in these decisions which may affect the futures of those we serve. May all their judgments begin, continue, and end with you. We thank you for inspiring us and uniting us in the vision and having a healthier nation. Grant us the wisdom that comes through the synergism of faith and action. Amen.
Thank you, Captain Sanders. Please be seated. Serving as the Master of Ceremonies for today's event is Rear Admiral Pamela Schweitzer, who works in CMCS, Division of State Systems. Admiral Schweitzer.
Thank you very much, and welcome to the 2015 CMS Commission Corps Ceremony. Before we begin, I would like to thank our Commission Corps Choral Ensemble. It's very special to have you here today. They are part of our U.S. Commission Corps Music Ensemble with over 100 performers, and a small group of them came up here today to be able to do this performance. They perform in events throughout the year, at retirements, promotions, and award ceremonies. And my favorite, their annual performance at the National World War II Memorial every year in Washington, D.C. We're so pleased that you will be able to break away from your regular duty schedule to come here. Please join me in recognizing and thanking our talented U.S. PHS Choral Ensemble. Thank you. We have some distinguished guests in the audience today that I would like that are assisting us today with the ceremony, and I'd like to introduce them. We are very pleased to be able to have today with us Mr. Andy Slavitt, our CMS Acting Administrator. We also have Rear Admiral Scott Giberson. He's the Division of Commission Corps Personnel and Readiness in the Office of Surgeon General. We have Rear Admiral Sylvia Trent Adams. She's a Chief Professional Officer for Nursing, and she's also the incoming Deputy Surgeon General. And we have Captain Martin Sanders. He's the Chief Scientist Professional Officer, and all of them have traveled up here from the DC area to be with us. We also have several office directors that I want to welcome that are in the audience today. We have Cynthia Tudor from the Center for Medicare. We have Dr. Renard Murray. He's a consortium administrator for the Quality Improvement and Survey and Certification Operations. We have Elizabeth Handley, Director of Office of Human Capital. There you are. And we have Brian Martin. He's the Deputy Director, Division of Formulary and Benefit Operations. Yep, there he is. We have David Miranda, Deputy Director of Division of Consumer Assessment and Plan Performance. Very good, thank you. And we have Commander Jill Christ. She's a CMS officer, Commission Corps Officer Liaison. Where is she? There she is, back there. Okay, and we also have our regional offices that are kind of connected in. I'm not sure if you can see them. Hopefully they can see us right now. And there's several of them. We have in the Atlanta office, we have Captain Mason and Lieutenant Commander Lorraine Williams and Lieutenant J.G. Ashley Innes. In the Denver region, we have Robert Castile and Captain John Coleman. In the San Francisco office, we have Ann Dworty, she's the Associate Regional Administrator for the Division of Medicare Health Plan Operations, and Max Wong with the Clinical Review Branch for the Division of Medicare Health Plans, and Commander Molly Ayala. So it's a lot of people, that are supporting us. So it's been 4 years since we had a promotion ceremony at CMS. CMS employs 184 Commission Corps officers, and 17 were promoted this year to the next rank. And the promotion process is very rigorous, and it's a review board of several senior officers, and only a small percentage are promoted each year. So we're here to pay tribute to you, the officers being promoted, and to celebrate this achievement with your families, friends, co-workers, and fellow officers. We're so proud of you. So thank you to everyone for being here to celebrate this day with us. So the mission of the United States Public Health Service Commission Corps is to protect, promote, and advance the health and safety of our nation. So we're so fortunate to work alongside such passionate, brilliant colleagues that are improving the healthcare system for our beneficiaries in our nation. We make a difference every single day, and it's really truly an honor and privilege to work here at CMS for all of us. So at this time, what I'd like to do is introduce Mr. Andy Slavitt to provide the welcoming and open remarks. Andy is the acting administrator for the Centers of Medicare and Medicaid Services, and he has a leader of decades of experience. He's shaped and delivered important healthcare services and programs for millions of consumers. Please help me give a warm welcome to Andy.
Thank you. And on behalf of CMS, I want to welcome everybody, the friends, the family, the co-workers, and most importantly, the officers we're here to honor today. When Rear Admiral Schweitzer invited me to come speak at this ceremony and told me that there were 17 of you in the CMS family being promoted today, my first reaction was to be proud of each and every one of you who has worked so hard to earn this promotion and this honor. And as I thought more about it and learned more and asked more questions about what it takes for all of you to do your work in the Commission Corps, my growing understanding made me even more appreciative of the further service that you provide to our country and to citizens around the globe in time of need. You know, when I reflect upon the people in my life that have truly inspired me, these are people who seem to have a bottomless well of service. Not only do all of you give every day to the beneficiaries that we serve here at CMS, but you stand ready to be deployed in whatever call you need and in whatever way the Commission Corps asks of you. And that's truly inspiring, and I think for all the rest of us at CMS, it's an enormous honor. So I know I speak for all of the CMS staff who's not here today when I congratulate you and thank you for the service that you do provide and for the inspiration that you provide. I know that we now have Commission Corps members all over the agency in incredibly important and vital functions. And I talk now fairly regularly to Commission Corps aspirants, people who are thinking about what it would take to take the step and join. So I encourage those of you that have made this step and made the step successfully to keep reaching out to these people, because I will tell you, you are an incredible asset for our agency and for our organization. And we're so pleased to see the growth that you all have obtained personally, but also the growth that that creates for us here at the agency. So I want to thank you and encourage you who have worked so hard for this day to really relish in this accomplishment. You are accomplishing something that by its very definition requires you to be someone who overcomes obstacles, requires you to be someone who faces up to challenges that have no set solutions. And on most of the days you do that, there is nobody around to say thank you. There's nobody around to recognize you. And after all of the hard work and all of the commitment that you've put in and all the dedication and service, today is a wonderful day, and it's a day to be cherished. So I ask you all to please accept my congratulations and to really enjoy the fruits of all of the hard work and know that we're all incredibly proud of you.
So how many of you in the audience know what a challenge coin is? Okay. So it's a pretty cool thing to get one, isn't it? So anyway, what they are, this is like a military tradition, and it's given when there's a big achievement in recognition and in thanks. And so we want to thank you for your support of the Commission Corps. And so there's a secret handshake to get this. So here's what you have to do. There you go. You got it.
Thank you.
Okay, you're welcome.
Thank you.
Okay. Next, we'd like to have some remarks from Rear Admiral Scott Giberson. He's the director of the Commission Corps headquarters. He oversees the management of 6,800 officers in the U.S. Public Health Service. He's also the commander of the Commission Corps Ebola response in West Africa, and he deployed with the first wave of Corps officers in October 2014. So please welcome Rear Admiral Giberson. There we go. Did they give you your thing?
Can they hear me if I just talk, or do I have to be there?
You have to be here a little bit.
I'm a wanderer, so I don't like to usually stand behind the podium, but I will if I have to. That's okay. Oh, they have something for me. In the meantime, I'm going to give my challenge coin to the administrator here, Mr. Slavic. I'm going to just put that in my pocket. There you go. Can you hear me okay? All right, great. So I get to roam now. So welcome to the promotion ceremony. I want to give a little bit of background on what it means to be promoted. But first I want to bring greetings from the Office of the Surgeon General. Our Surgeon General, Vivek Murthy, is on a very important trip of his own today, a family celebration, a very important family celebration for himself. So he couldn't be with us. But he sends the best to CMS, to Mr. Slavitt, and to all the promotees for their great work and accomplishment. So he's very aware of where we are today, and myself and Rear Admiral Trent Adams, who's our incoming Deputy Surgeon General, we're holding down the fort till he gets back. So a little bit about CMS first. CMS, if you think about what CMS encompasses right now, what an incredible performance, I would say, in the last few years of what they've done and what they're a part of in transforming the health in America. What it really is ensuring health security. And if you think about how that relates to the Commission Corps, you think in 1798 the Commission Corps was the Public Health Service. The U.S. Public Health Service was formed in 1798 because health security was important to seamen and sailors coming back from the seas, and we would take care of them. In 1889, we became a militarized service called the Commission Corps of the Public Health Service, because somebody thought health security was important enough to have a whole uniformed service dedicated just to that. Now we have an agency, a very large agency in CMS, that has to help ensure the health security of every American. And they celebrate their 50th anniversary with, I think, and I'm probably off a little bit on the numbers, but 55 million people on Medicare and 70-some million people on Medicaid. And they're in charge of the Children's Health Insurance Program and many, many pieces of the Affordable Care Act as we increase access to health care. So really the very foundations of public health that we, the Commission Corps, are supposed to also be experts in is what CMS does right here. So what an incredible partnership we have. So that's a little bit about the background and the connection really between what we can do as a Commission Corps and what the CMS does for the nation's health. Promotion. Promotion means a lot of things. The most visible people would think, or most perceived thing is, hey, I got promoted, I get a little bit more money in my pocket, I get a couple more stripes on my shoulders, or half of one stripe, and I'm proud of what I've done. Past tense. It's a reward for the performance that I've done. We view it a little differently. It is something to be proud about. It's something to say, good job, pat on the back. But we view it a little differently. I view it as, now it's time for me to change. Now it's time for me to accept more responsibility. I cannot remain constant. I cannot remain in an idle state. I have to be dynamic. I would expect, who's supervisors here of these promotees? Supervisors? I'm going to give you the green light to give them more responsibility. I know you didn't want to hear that. Look, these are rolling their eyes over here now about that. As a higher ranking officer, you have to accept more responsibility. That's part of the deal. That's why they got promoted. About 20% of the people get promoted. That's not a very big amount. And they have to wait 5, 6, 7 years to get that chance to be one of the 20% to get promoted. So you can see it's not easy. And we ask them to work in higher positions than they are currently ranked. I gave an analogy to Andy before we talked about it here. If you're a GS-13, you'd be working in a GS-14 level for 5, 6, 7 years before you got the chance to get promoted to GS-14. So that's a little bit similar to what we do in the Corps. And we ask them to do the higher level of work. So feel free to give them more work. It's about mission. We talked about the mission of CMS, ensuring the health security. We have to be prideful of the mission because that's our primary responsibility. The primary responsibility of these officers is to make sure that they do a perfect job for their agency, whatever they're assigned to, whether it's the Indian Health Service or CMS or FDA or CDC. But they also have to serve the Corps' mission too. They have a duality of their mission, and hopefully they're synergistic. So we're going to ask them to be ready 24/7, to be on call, if you will, every day of the year. And if something happens in the nation domestically, or if something happens internationally, we expect them to be ready to respond. They can respond here domestically, or they can respond overseas like we did with the Ebola crisis. And many CMS officers did join us in Africa, in West Africa, for the response to Ebola. So thank you for that support in allowing them to go to Africa. It's about the team. So we talk about mission and we talk about the team. Not a single one of these officers could get promoted without the team behind them. And their team starts from their colleagues at work. Their colleagues at work, other commissioned officers, civilians here that support them, that do the work when they're deployed, that really lift them up and carry them through this promotion process and the years leading up to promotion. It's about their supervisors, supporting them in the duality of their mission and their responsibilities to the Corps. That team also extends to family members. How many family members do we have here? A couple few family members? Thank you for your support. I can tell you that your job's not over, though, just because they got promoted. Maybe another promotion ago. But they'll expect your support even more now that they're promoted and they have more responsibility. So thank you to the family members and the support of the team. Finally, it's about evolution. As I mentioned, I expect them to take on more responsibilities. And I'm gonna read a quote here, and I wrote it down because I didn't want to get it wrong because there's a very important person that said this. He says, as we preserve and advance Medicare for future generations, we are focused on helping build a better system with smarter spending that keeps people healthier. That does not sound like a person that wants to remain static. That sounds like a person to me that wants to evolve, that wants to manage change. That's obviously Mr. Andy Slavic here. So, great quote. I expect that of the officers too, because people who survive in the professional world are not the smartest. They're not the hardest workers. They're the ones that can manage change the best. And if you're going to be dynamic and you're going to be in CMS, you're going to have to manage change real well. And there's a high expectation of CMS. We have a same high expectation of our officers. It's a great match. I thank you for having me here, and I congratulate the officers on your promotions. So thank you, everyone, and have a good promotion ceremony. Thank you, sir. Thank you. Good job.
Okay, thank you so much for those inspirational words, both of you, Rear Admiral Guyberson and Andy. So at this time, we're going to begin with the promotions. Lieutenant Butler?
So we are first going to go to our regional offices and the promotions for captain. The first is a health service officer. And I would ask if you all wouldn't mind, Captain Todd Alspach, if you wouldn't mind standing as we read the attention to orders, please. Attention to orders. By order of the Assistant Secretary for Health and the Surgeon General, for the following officer is hereby promoted to the temporary rank of captain. Signed, Vice Admiral Vivek Murthy, Surgeon General of the U.S. Public Health Service. Ladies and gentlemen, please be seated.
Captain Todd Alspach is a certified medical technologist with Occupational Health and Safety. Today he is here with his wife, Deshang, who will pin on one side of his boards, as well as his children, Audrey, 13, and Kyle, 9, who will pin on the other side. His supervisor, Robert Castillo, will also be in the audience. Presently, Captain Alspach is assigned to the Centers for CMS as a CLIA supervisor. Captain Alspach has previously served with the Food and Drug Administration, Federal Bureau of Prisons, and Centers of Disease Control and Prevention during his 13-year career with the United States Public Health Service. He is an active member of the Health Services category, where he was appointed to 2 terms on the Health Services Professional Advisory Committee and was the 2014 PAC chair. In addition, Captain Alspach was a long-standing voting member of the Medical Laboratory Scientist Professional Advisory Group, a member of RIST 8, and has previously participated in the Public Health Ensemble and several other COA branches. Prior to his service in the Corps, Captain Alspach worked in the private sector in a variety of settings in the laboratory field. Congratulations, Captain Alspach.
A little bit of exercise today. If you wouldn't mind, please stand as we call the attention to orders. By order of the Assistant Secretary for Health and the Surgeon General, for the following officer is hereby promoted to the temporary rank of Commander. Signed, Vice Admiral Vivek Murthy, Surgeon General of the U.S. Public Health Service. Everyone, please be seated.
Commander Tukes will be joined by his 3 sons, Ray Jr., Joshua, and Darius Tukes. Captain Mason will also be assisting with the pinning in Atlanta. Commander Tukes joined the Commissioned Corps in 2003 as a nurse and began his career in the Federal Bureau of Prisons in Atlanta. He started at CMS in 2012. He is an account manager with the Program for All-Inclusive Care for the Elderly, or PACE. Commander Tukes served in the U.S. Air Force Reserves from 1985 to 2000, where he was first served as an enlisted person and then as an officer as a flight nurse. He earned a Bachelor of Science in Nursing and a Master's of Health Science with a concentration of Public Health. Commander Tukes is married and has 6 boys, 2 of which are in college, and the youngest at West Point Military Academy. Go ahead and change the boards. Congratulations, Commander Tukes. Next, we're going to promote Commander Monica Rita Sante. She's here with her supervisor, Elena Chaudhry, who will be helping with the pinning ceremony, as well as her husband, Diedrich, and their daughters, Jameson and Ella. Commander Monica Reed Asante joined the United States Public Health Service in 2010. She worked in the Division of Formulary and Benefit Operations from 2009 through April of 2013, where she served as a team lead, a project officer on Part D formulary contracts, and developed audits and analysis of formularies. In 2013, Commander Reed Asante joined the Division of Payment Policy, where she continues to serve as a project officer and assists with the evaluation of risk adjustment models and the development of policies related to risk adjustment as the acting division director. Congratulations, Commander Monica Reed Asante.
And if you wouldn't mind standing one more time. Attention to orders. By order of the Assistant Secretary for Health and the Surgeon General, the following officer is hereby promoted to the temporary rank of Lieutenant Commander, signed Vice Admiral Vivek Murthy, Surgeon General of the United States Public Health Service. Ladies and gentlemen, please be seated.
Our first Lieutenant Commander to be promoted is Lieutenant Commander Tillman of San Francisco. Her mother and sister will be joining us in the Baltimore auditorium. Are they here? Please stand. Thank you. Supervisors present are Ann Duarte, Associate Regional Administrator of the Division of Medical Health Plans Operations, Max Wong, Clinical Review Branch of the Division of Medicare Health Plan Operations, and I believe they are also in attendance. Lieutenant Commander Tracy Tillman is a Health Service Officer at the San Francisco Regional Office. She serves as a Health Insurance Specialist in the Division of Medicare Health Plans Operations. She provides casework assistance to marketplace consumers and Medicare beneficiaries. She started with CMS in 2015 and has stepped into a variety of leadership roles within her division. She holds a master's degree in public health and is currently pursuing a second master's in social work at Simmons College. As a recent transplant to the Bay Area, she enjoys long walks on the beach with her precocious dogs and has taken up hiking in her off-hour duties to explore her new home on the coast. At this time, you can go ahead and do the board change. Oh, opinion. Congratulations, Lieutenant Commander Tillman. Lieutenant Commander Marie Mantufel. She's here with her supervisor, Christian Bauer, and I believe Admiral Schweitzer will also help with her boards. Or, I'm sorry. Lieutenant Commander Marie Mantufel is the Senior Assistant Pharmacist with the Division of Part D Policy at CMS. She earned her Doctor of Pharmacy degree at the University of Wisconsin and a Master's of Public Health degree from Emory University in Atlanta. Prior to joining the Public Health Service and starting with CMS, Lieutenant Commander Mantufel previously worked with Washington State and at various Walgreens and pharmacy locations in Wisconsin, Georgia, and Virginia. She lives in Silver Spring, Maryland with her husband, Michael. Congratulations, Lieutenant Commander Marie Mantufel. Our next promotee to Lieutenant Commander is Tisha Robertson. She'll be joined with Brian Martin, will be helping with her pinning, as well as Admiral Schweitzer, potentially. Lieutenant Commander Tisha Robertson received her doctorate degree in pharmacy from the University of Maryland in 2005 and her MBA from the University of Baltimore in 2005 after completing her managed care ambulatory care residency at the University of Maryland and Blue Cross Shield the following year. Since August 2012, Tisha was one of the pharmacists on the formulary team with the Division of Formulary and Benefit Operations and became the formulary technical lead pharmacist within DFBO in October of 2014. In this role, Tisha serves as a professional pharmacist, developing Medicare prescription drug policy, including classification of drugs, competitive bidding, clinical review of new drugs, and other medications. In her free time, Tisha enjoys traveling and delights in spending time with her family and friends. Congratulations to Lieutenant Commander Tisha Robertson. Next, we have Commander Oliva Taylor. Unfortunately, was not able to be here today. Lieutenant Commander Julie Zucco will be our next promotee. Lieutenant Commander Julie Zucco has been at CMS for 5 years, beginning as a civilian in 2010 before joining the Corps 3 years ago. While at CMMI, she conducted evaluations of demonstrations under the 2010 Affordable Care Act, as well as the Balanced Budget Act of 1997. Lieutenant Commander Zucco is currently at CM working on survey management and star ratings. She graduated with a BA from the University of Pennsylvania with a double major in biology and anthropology. After working as a consultant and a project manager for a number of years, Lieutenant Commander Zucco returned to school and received her doctorate in epidemiology from the University of Maryland at Baltimore. Lieutenant Commander Zuko and her husband are expecting their first child in mid-October. Captain Sanders will be helping with the pinning ceremony. Congratulations, Lieutenant Commander Julia Zuko.
We will now have closing remarks by Rear Admiral Schweitzer. Ma'am?
You guys, everyone did it. So I wanted to add my congratulations to all of the officers who were recognized today. Your dedication to public health, your jobs here at CMS and the Commission Corps has really led to this important step in your career. And promotion truly is an accomplishment, and it's also, as Rear Admiral Guyverson said, a responsibility. Because of these high standards and limited openings, there's not many officers were able to get promoted, so you should be really, really proud of this achievement. But this recognition is also accompanied by the responsibility to your fellow officers, to the public health, and to accomplishing the mission, not only the public health service mission, but the mission here of CMS. So this requires, as Rear Admiral Guyverson was saying, that each of you to increase your determination, your resourcefulness, and look for better ways to have as significant impact as possible. So with each increasing rank, and this really applies to all of us, whether we're promoted or not, but it's with each of us, as we get increasing ranks, other officers will look to you now more as a model in how you carry yourself, how you make decisions, and how you treat others. So you're going to have an increased duty to be a mentor and an advisor and to guide others, officers, and other people. And so you're an example, going to be an example for all of us and your coworkers and your peers. So while today's a day of celebration, you've accomplished and recognize your success. It's really a day to recognize the opportunity to become a public servant, an example to other people, and a spokesperson for the U.S. Public Health Service. So we couldn't do this without our families and with all the friends and coworkers that we have around us. And I just really want to congratulate. This is really a big event. I also want to take a few minutes and thank all the people that were involved in putting this together, this whole program together. As you can tell, there was a lot of coordination with the regions and with all the different officers and all the little pieces that put together. We started on this a couple of months ago, and it really couldn't have come together. There's about 40 officers that helped and participated in some way. So I'd like to thank all of them too. So I'll let you announce about the refreshments. But anyway, this is going to be concluding it here. In just a few seconds, we'll be leaving, and there's going to be refreshments out on the side. And we hope that you're all take the time to be able to congratulate these officers in person and visit with them too. So.
Thank you, Admiral Schweitzer. Last time, if you wouldn't mind, please standing as the official party leaves. As the Admiral said, please join us in the lobby for refreshments. There's also an opportunity to have additional photos taken of the promoted officers and your families. Thank you very much for attending today. Have a great day.